Which of the following behavior definitions will be best to include in a behavior intervention plan? Let's go over behavior definitions. What is included in a good behavior definition? Ideally, we would want to know how it looks, what the function is, so why it happens, and most importantly, behavior definitions should be observable and they should be measurable. We want an objective look at what we're trying to see. In other words, if you gave this behavior definition to 10 different people, all 10 people would measure the same behavior. That is an ideal behavior definition. This question wants to know which of these 4 definitions would be best to include in a behavior intervention plan. So you're essentially looking for the definition that is observable, that is measurable, and that includes the most relevant information. Let's look at A. Greg becomes aggressive and will lash out at peers when he wants attention. This question does include the function, which is great. We know why it's happening. However, aggressive and lash out, how does that look to you? Think about what you think when you hear the word aggressive or lash out. What you're thinking could be very different than what I'm thinking. This doesn't actually tell us how the aggression looks or what lashing out is. This would be a very difficult definition to measure consistently. So far, A isn't great. Let's see if we can find a better answer. B, when frustrated, Greg will throw closed fist punches at peers. Okay, at least we know what it looks like now, right? We know what the aggression looks like, closed fist punches. But frustrated, again, think about frustration. What you're thinking about, how you would observe it, how you would measure it, could be very different than what I'm thinking about. These little mentalisms like frustration, we can't really observe, we can't really measure. They really should not be included in behavior definitions. B is definitely out. A is still our best answer. What about C? Greg will close his hand into a fist and attempt to hit and punch peers. This is much better, okay? We now know exactly what the behavior looks like, right? We don't necessarily know the function, but I would rather C because at least we know what it looks like compared to A when we don't know what it looks like, okay? So C is still going to be better than A, but what about D? To gain attention, Greg will close his hand into a fist and attempt to hit and punch peers. Yes, right? At least this one includes our function plus the topography or what the behavior looks like. So by far, right, D is going to be our best answer. Greg will close his hand into a fist and attempt to hit and punch peers. That's the topography. To gain attention, that's the function. Ideally, if we gave this to 10 different people, we would get the best data compared to our other definitions. Question 2. What type of interval recording typically overestimates the occurrence of behavior? What do we know about interval recording? We know it's discontinuous, so we're not capturing every instance of behavior. We're only capturing behavior during our specified intervals. And when this happens, you're likely to miss some sort of behavior, right? Now, if we're going to overestimate the occurrence of behavior, then we're going to say it's happening more often than it actually is. Okay, maybe at a higher rate, higher magnitude, whatever that might be. Now, which of these interval recording would typically overestimate the occurrence of behavior? We can eliminate D. Why? Because D is not discontinuous, it's not interval recording. Interval response time is continuous. Momentary time sampling sometimes may overestimate, sometimes may underestimate. Okay, we're looking for the one that typically overestimates. Think about partial interval. If you're conducting partial interval recording, when are you recording a response? Well, if the behavior happens at all, right? So if we have 20-second intervals and that behavior happens for 1 second in that interval, it looks like a response on the data sheet. So let's say we have 5 intervals, 20 seconds each, okay? So you have 100 seconds, all right? That behavior might have happened 5 seconds, but if it happened in each interval, it looks like that behavior happened the entire time. This is overestimating that occurrence of behavior. Whole interval is the opposite. It's going to underestimate. Same thing if we have 20-second intervals, right? That behavior could happen for 19 seconds during whole interval, but it still doesn't count, okay? So, other words, partial interval typically overestimates the occurrence of behavior, while whole interval typically underestimates the occurrence of behavior, okay? Don't worry if that's a little technical. It is, okay? Come back to this one. They probably, they typically will want to know, are you familiar with partial interval and whole interval and how it relates to how our data looks? Okay. They want to know that you can take partial interval and whole interval data, when it's used, and what that data might do when you do use this type of intervention. Okay. So make sure you know that discontinuous measurement just as well as that whole or that continuous measurement. Okay. All right. Question 3. Under what circumstances might it be most appropriate to teach your client using backwards chaining? Think about what we do when we use backwards chaining. We start with what step first? We teach the last step first. Okay. That's confusing, right? Backwards chaining is a little difficult to wrap your head around because it's not how you're used to teaching. How do we usually teach? We start at the beginning. We teach first step to back, right? We use forward chaining. Backwards chaining, though, is a reasonable method, okay? Even though we might not use it as often as forward chaining, there's a time and a place where we would use it. So again, backwards chaining is what? We prompt through the whole task, and then we have the client or the learner complete the last step, and then we reinforce. So when might you use this type of chaining? A, if the client struggles starting a task independently. Well, sure, think about backwards chaining. They don't have to start the task independently. We're going to prompt them through that whole task starting from the beginning. They only need to complete that last step, okay? So if your client struggles starting a task, backwards chaining might be better than forwards chaining where they need to complete that first step, okay? So sure, A might be appropriate. What about B? If the client often engages in escape-maintained behavior. One of the great things about backwards chaining is that last step functions as escape. It functions as reinforcement. So if the client often engages in escape-maintained behavior from tasks, backwards chaining might be great because we're still prompting them through that whole task. We're helping them step by step. And then once they actually do something independently, they're immediately reinforced. So both A and B would be good situations. What about C? If the client quickly learns new skills. If the client quickly learns new skills, then we might as well just forward chain or total task chain, okay? It is in a lot of ways easier, right? It's the more common method. So if they quickly learn new skills, just forward chain it, start with the first step or teach the whole thing, right? We're talking about unique situations where we have a client who engages in behavior or who struggles starting tasks independently or who struggles completing tasks by themselves, right? So C, if they're quickly learning new skills, forward chaining would probably be better. However, we said both A and B would be good situations to teach your client using backwards chaining. Therefore, our answer is going to be what? It's going to be D, both A and B. You're deciding what to order at a restaurant with your family. Originally, you wanted the fish, but your brother said the steak looked good. When the waiter asks you what you would like to order, you say, steak, please. What is the motivating operation in this scenario? So think about what a motivating operation is, okay? A motivating operation makes you essentially want or not want something. It's going to increase or decrease the value of the consequence. What is an SD? An SD, a discriminative stimuli, signals that a consequence is available. It's an important distinction. In this scenario, what is making you want the steak? What increases the value of the steak? Let's look. A, the waiter asking what you would like to order. Is that the MO or is that the SD? Well, that's going to be the SD, right? The discriminative stimuli. Why? Because only when the waiter asks you what you would like to order is the steak actually available, okay? You might want that steak. You might want to order that steak, but you can't order the steak until the waiter actually asks you, okay, what would you like to order? That makes it the SD, okay? So what about your brother saying the steak looked good? That is going to be the MO, right? That's going to make you want that steak because originally you wanted the fish, but only when your brother said the steak looked good did that steak increase in value, making you want that steak more, increasing the motivation to what? To order the steak. Okay, so B is going to be our motivating operation. Now, SDs are pretty straightforward. You know, people typically think of them as the instruction, right? MO is a little more complicated, right? Just remember, MOs, motivating operations, make you want or not want. SDs says the consequence is actually available, okay? What about C, you ordering the steak? Well, you ordering the steak is just the response, right? And then D, you deciding what you wanted to order at the restaurant. That was the very first thing you're doing. That was not the MO, because originally you wanted the fish. Only after your brother said the steak looked good did the motivation to order the steak increase, did the value of the steak change, right? Then the waiter asked you what you would like to order, which was the SD. You engage in a response, steak, please. Consequence is what? Consequence is you get steak. Go through this question a few times, all right? Understand the difference between SDs and MOs. That's important. I always say the fundamentals, right? Fundamentals. Fundamentals are reinforcement, punishment, extinction, MOs, and SDs. Got to know those 5 things first, okay? And of course, the functions, right? All right, moving on. When speaking with parents, other stakeholders, or anyone not trained in applied behavior analysis, you should communicate how. Question's a little vague, but what the question is asking is how should you communicate with people who don't know what we're talking about? We use technical language, right? If I tell you differential reinforcement, you know what that is. If I tell you to use a prompt, you know what that is. If I say escape, maintain behavior, you know what that is. However, parents who aren't trained, stakeholders who aren't trained, might not, right? So how should you communicate with these people who don't know these technical terms? A, by using terminology that the listener is able to understand. Absolutely. When you're communicating with anybody who isn't trained in ABA, you want to speak on their level. We're not there to show how smart we are or how much we know about ABA. All right. We're there to train and help the other person understand what we know about ABA. Because remember, the stakeholders, typically, if you work in ABA and you work with autism, the stakeholders are responsible for the client. So we want them to understand what's going on with the client. And how we do that is talking to them in a way they'll be able to understand. So we avoid using the technical language and jargon. You don't go in and start demonstrating how much you know about ABA. You go in and demonstrate how much you know about the client. That is the key. Okay. C, you should avoid speaking with these individuals whenever possible. No, collaboration is a key part of what we do. It's a very important part of what we do. And then D, in a relaxed and unprofessional manner. You can be relaxed, but we should never be unprofessional. Okay. It's a very professional job. So how should we communicate? We should communicate using terminology that the listener is able to understand. Your BCBA conducts an assessment of the client's reinforcement schedule. She tells you she now wants you to deliver reinforcement on a VI3 schedule. When should you be delivering reinforcement? Pause. Don't even look at the answer choices yet. Let's try to predict this one. Okay. Attack the question, attack the question, attack the question. You are now delivering reinforcement on a VI3 schedule. Let's break it down. What does variable mean? Well, we have variable, we have fixed, right? Fixed means the time requirement or the response requirement doesn't change. Variable means we're delivering on an average. So we have a variable schedule. We're going to be delivering on some sort of average. Interval, right, is what? Interval is time. The other option is ratio, which is responses, but we have a VI3. So we have an interval schedule. What do we know? We're now going to be delivering after an average amount of time. That 3 just simply tells us, okay, how much time. That's what we're predicting. We're looking for a schedule, or we're looking to deliver reinforcement on average across the amount of time with a 3, all right? So A, after every third correct response, nope. Why? Because we're not dealing with responses, we're dealing with time. B, after 3 minutes passes, okay, wait for a correct response and then deliver reinforcement. This is better, but is this fixed or is this variable? Well, this is clearly fixed, right? It's not changing. If we're waiting after 3 minutes every single time, that is fixed, right? We need a variable schedule. C, wait about 3 minutes on average, and then wait for a correct response to deliver reinforcement. Boom, right? This is on average. It's based on time, and it's based on 3 minutes. This is what we're looking for. C is going to be our answer. What about D? You'll need to get more information from your BCBA to determine when to deliver reinforcement. Note, we have plenty of information to make this call. If we're doing a VI3, we're waiting about 3 minutes on average. That's the key. And then wait for a correct response to deliver reinforcement. Greg is arguing with his little brother. Greg says, I'm going to tell mom. His little brother says, I'm going to tell mom. What type of verbal behavior is the little brother displaying? As I always say, as an RBT, you would need to at least be familiar with these 4 main verbal operants. These are the ones you're going to be dealing with most. All right. This one's pretty easy. What is happening? The little brother, that's the person who we're focused on. Always identify whose behavior you're looking at. We're looking at the little brother. What did the little brother do? Well, he copied his big brother. His big brother said, I'm going to tell mom. Little brother said, I'm going to tell mom. What did he display? Was this attacked? Well, what is attacked? Attacked is simply a label. Did the little brother label anything? No. What about an intraverbal? What is an intraverbal? An intraverbal is a exchange. It's a conversation. The key is, in an intraverbal, when the speaker says something, the listener says something different. In this case, the speaker, Greg, said, I'm going to tell mom. The listener, the brother, echoed Greg, right? So the little brother engaged in an echoic. And then a man is simply a request asking for something. Now, this isn't necessarily even on the task list. Again, though, just understanding behavior and understanding applying behavior is important, okay? Just being familiar with these 4 words, because the odds are you're going to see them in some form or fashion on the RBT exam, okay? At least you'll be better prepared, right? You're just trying to add to your repertoire of knowledge. The more you can add to your repertoire of knowledge fluently, the better off you're going to be on the exam. Escape maintain behavior could also be considered what? Positive reinforcement, negative reinforcement, positive punishment, or negative punishment. So reinforcement question, punishment question. How do we break it down? We ask ourselves, are we looking at adding something or taking something away? And are we looking at a behavior increasing or decreasing? Well, we know escape maintain behavior is what? It's behavior that continues to persist through escape. Escape is one of our functions. So the behavior is what? The behavior is reinforced via escape. So we're dealing with what? We're dealing with reinforcement. So we can eliminate positive punishment and negative punishment. Now, escape maintained. Are we adding something or are we taking something away? Well, if you're escaping something, what are you doing? You're getting out of it, right? You're removing or getting away from whatever aversive stimuli is in front of you. So you're removing the aversive stimuli, which is reinforcing your behavior. Your behavior is being maintained through escape. Therefore, we're dealing with what? We're dealing with negative reinforcement. Escape maintained behavior can also be considered negative reinforcement. This is why when you give, let's say, a student a worksheet and they rip up the worksheet and you say, okay, you don't have to do the worksheet, you let them escape, they continue ripping up the worksheet because of negative reinforcement. A crisis emergency plan would reasonably cover how to handle all of the following situations except for what? What is a crisis/emergency plan? It's a plan for the RBTs to know what to do if they're in danger, if the client is in danger, or if someone else is in danger. A crisis emergency plan should be included in every behavior intervention plan, no matter what, especially if you know there's a risk of danger. This question wants you to answer what? This question wants to know which of the following situations would not be reasonably covered by a crisis emergency plan. Okay, when will we not need one out of all these situations? A client engages in hair pulling and refuses to let go. Can this put someone else in danger? Absolutely. This can cause pain. This can cause harm. Certainly, if your client is a hair puller, there should be a plan in place if they start pulling hair. B, a client will pick up objects and throw them around the room. Yes, this is a major danger, right? I mean, maybe they just, for now, are throwing small items, but what if they start picking up chairs? What if they start picking up desks? What if they pick up sharp objects, et cetera, okay? This is when we use a crisis emergency plan to try to prevent or react to situations like this. Client picking up objects and throwing them around the room, certainly people can be put in danger, definitely going to need a crisis emergency plan. C, a client will verbally abuse RBTs and teachers. Now, verbal abuse. Can it hurt your feelings? Yes. Can it be frustrating? Yes. Are you actually in danger from the verbal abuse by the RBT or the client? No, right? Especially, you're just really not. Okay. Verbal abuse, as frustrating and as hurtful emotionally as it can be, compared to hair pulling and throwing objects around the room, it's just not as dangerous. Okay. So far, a crisis emergency plan would least be needed for a client verbally abusing RBTs and teachers. What about D? A client will attempt to run out of buildings. Well, absolutely, right? That's extremely dangerous if a client is attempting to elope from buildings. Okay. I mean, if you picture yourself at a clinic with a busy street outside, okay, certainly a plan would be needed for that. So, out of all of these, right, the least likely you would need a crisis emergency plan would be simple verbal abuse from the client. Now, yes, you could argue, well, what if that verbal abuse turns into something else? Okay, but on the exam, we are using the information given. And based on the information given, the other three are much more in need of a plan compared to simple verbal abuse. As an RBT, how often should you record session notes? At the end of each session, at the end of each week, at the end of each month, or at the end of each year? It's a requirement of RBTs to record session notes. This gives insight to the BCBA, gives insight to the other RBTs on what is happening in your sessions. When should you record session notes? Obviously, at the end of every session, you should be taking notes. What happened? Objective, measurable. Did you master anything? Any new behaviors? Anything important take place? End of each week is not often enough, just like the month, just like the year. After every session, you should be recording session notes. Okay, thanks for watching. Please like and subscribe. Check out rbtexamreview.com for all of our study materials. Any questions, comments, please let me know. I'd love to help. Other than that, work hard, study hard. See you soon.